Move over Ozempic, there's a new sheriff in town. At least that's what Eli Lilly wants us to think. They have just released new data on their medication Mounjaro, which is a competitor to Ozempic and Wegovy. We're going to take a deep dive into these medications, explain the differences between them, how they work, how effective they are, their overall side effect profile, and their cost. After that, we're going to take a look at the placebo group to see how we can lose weight without taking these medications. This is the Prescription Press, the podcast where we break down medical news stories so we can live healthier and better lives. I'm your host, Nolan Fisher. Let's do it. Okay, we're going to start this episode by talking about the drug that has dethroned cocaine and Adderall as the weight loss drug of choice for rich people, and that's Ozempic. Before we start talking about how Ozempic works, I have to say that I was on their website the other day, and I was doing some research for this podcast, and there is a heading that says, should I expect to lose weight while on Ozempic? And in bold underneath it, it says, Ozempic is not a weight loss drug, which is hilarious because that's how Ozempic has gotten so notable in society, right? Is as a weight loss drug, even though it's intended as a type 2 diabetes treatment. Let's look at how Ozempic works. And we've gone over this before, but I want to touch on it again because it's important to understand this to differentiate between Ozempic, Wegovy, and then Mounjaro. So Ozempic works as a GLP-1 receptor agonist. That means that there's a chemical called GLP-1 in your body that binds to GLP-1 receptors. By agonist, it just simply means that it activates that receptor and causes something to happen in your body. There's also drugs that are antagonist, and when they bind to the receptor, they cause that process to stop. So it's a GLP-1 receptor agonist. What's interesting is that it's a synthetic version of GLP-1, which is 94% similar to the GLP-1 that is naturally released in our body. And it works on three main areas. The first one, and the intended one for type 2 diabetes, was the pancreas. By working on the pancreas, it actually causes more insulin release and then an increase in insulin sensitivity. In type 2 diabetes, there's dysregulation between how our body deals with sugar. So as a result, you're not as sensitive to insulin, so more sugar stays in the blood. And then as a result, there's complications that ensue because it clogs up your arteries, causes all sorts of issues like heart attacks, strokes, nerve damage, that sort of thing. So they expected it to work on the pancreas, but it also works in other places as well. So the other place it works is on the stomach. In the stomach, this GLP-1 receptor causes your stomach to empty slower. So as a result, the food sits in your stomach for longer, which causes you to feel fuller for longer. Then it also works in your brain. And the way it works in your brain is by decreasing cravings and decreasing hunger. And that's why people who take Ozempic notice that their cravings for different sweets and things that they usually crave are much lower than usual. So just to recap that, Ozempic works on the pancreas by increasing insulin sensitivity, in the stomach by slowing down how fast your stomach empties, and then on your brain by decreasing your cravings and making you less hungry. So since it is technically a type 2 diabetes medication per its FDA approval, let's talk about how effective it is at treating type 2 diabetes. Before we talk about the effectiveness, though, we need to talk about A1C. So the A1C is a measurement of your blood sugar over the last 90 days in your body, and it's measured as a percent. The usual percentage is around 5.5. In different studies, they have found that getting that level below 7% for people with type 2 diabetes has better outcomes. So in the studies for type 2 diabetes medications, they set that 7% as their goal. So with Ozempic, their studies looked at how effective this medication was at getting the A1C under 7%. And their average starting point was 8%. They found that 73% of their patients who took this medication were able to get their A1C under 7%, which is a really good result. But then, of course, they noted the side effect, and that was weight loss. And what they found was that the average person lost about 14 pounds, which they started at 219 pounds. So they lost on average maybe around 7.5% of their weight. Now, it's important to note that the people in this study were not only type 2 diabetics, but they were also obese. And so, therefore, it was harder for them to lose weight than it is for people who just have obesity and not type 2 diabetes. So, we'll just remember that it's about 7.5% weight loss for now. However, I want you to remember that these people in this study had both type 2 diabetes and obesity. And we'll look at that more when we talk about Wegovy. As for the side effect profile, 20% of the people in the study experienced nausea, 9% experienced vomiting, and 8% experienced diarrhea. And those were the most common side effects. With any of these medications that are the GLP-1 receptor agonists, there is this black box warning for thyroid cancer. However, this is only demonstrated in rats, and that's because they give them extremely high doses, and so they don't know if this correlates to humans or not. So obviously that's a concern, but we won't know how many people are getting thyroid cancer until much later, but it doesn't seem like that number is very high for now. As for the cost of Ozempic, I did some digging around, and it looks like about $1,000 per month is the out-of-pocket cost. With insurance, it tends to vary. Some insurances do cover it, but if you look on GoodRx, for example, you can find it for about $1,000 per month. One thing we have to note is that Ozempic is made by Novo Nordisk, and it's the brand name. However, the generic name is semaglutide, and semaglutide is the same medication that is their other brand name drug called Wegovy, and Wegovy is FDA approved for weight loss. So we're going to look at that now. The difference between the two is just the dosage. Okay, Ozempic starts at 0.25 milligrams and can go up to 1 milligram for the dose, whereas Wegovy starts at 0.25 milligrams but can go up to 2.4 milligrams, which means that the maximum dose of Wegovy is over twice as high as the maximum dose of Ozempic. And then there's some other notable things that are different. And that's the type of research that they did on people who are taking Wegovy. Because it is not a medication to treat type 2 diabetes, they decided to treat people with obesity, but not with type 2 diabetes. And this is important because people with type 2 diabetes have a metabolic syndrome. And so it is harder for people with type 2 diabetes to lose weight. And the reason for this goes back to that insulin sensitivity. If you're not as sensitive to insulin because you have type 2 diabetes, that means your overall insulin levels are higher. The higher your insulin levels, the harder it is for your body to undergo lipolysis, which is literally just the smart word for breaking down fat. So as a result, people with type 2 diabetes will say things like, I'm exercising, I'm not eating that much, and I'm not losing weight. And that's right, because they aren't breaking down fat as efficiently as somebody without type 2 diabetes because their insulin level is higher at baseline. So the first step to losing weight for these people is getting their insulin level back down to baseline by getting their metabolism going the right direction and cleaning up their diet, and then the weight loss will follow afterwards. And that's the difference with the study on Wegovy versus the study on Ozempic. In Ozempic, the people had type 2 diabetes. In Wegovy, they don't. So the results for Wegovy were really good. So over about 70 weeks, people started at 232 pounds on average, and they lost about 35 pounds, which was about 15% of their body weight, which was double that of Ozempic. We also have to remember that those people were taking half the dose, less than half the dose, and they also had type 2 diabetes. As for the side effects, they were about the same as Ozempic, with about 20% of people with nausea, 10 to 15% of people with vomiting, and then around 10% of people with diarrhea as well. The cost for Wegovy, though, is much higher. From what I found online, the out-of-pocket cost is about $1,700 per month, and sometimes it's covered by insurance, but insurance is going to push back against this because it's not treating type 2 diabetes as well. Okay, so we've looked at Ozempic and we've looked at Wegovy. Same medication, semaglutide. They're just different doses, and the studies were done on populations that were different. So it's not comparing apples to apples. However, Eli Lilly's new drug, Mounjaro, was done on a similar population as Ozempic, and that's obese people with type 2 diabetes. The brand name for Mounjaro is tirzepatide, and it works similar to Ozempic, but it has an additional feature. So Ozempic and Wegovy work on that GLP-1 receptor. We talked about that. And Mounjaro also works on that GLP-1 receptor, but it also works on something called a GIP receptor, which makes your body release more insulin once it feels that the stomach is full. So that's the only difference between the two. The idea that Eli Lilly had was that by having both of those actions, the GLP-1 and the GIP receptor, that the medication would be more effective. So they just published the results from their study called the SURMOUNT-2 trial, and they put it on their website. And this was to treat people with type 2 diabetes and obesity. They treated them for like 68, 70 weeks, something like that. And they found that those people started at 222 pounds. They lost on average 34.4 pounds, which was 15.7% of their weight. They also didn't give the specific numbers as to the amount of people that got to their goal A1C, but they did say it was better than Ozempic. As for the side effects, they had more side effects with Mounjaro than Ozempic had. And that's 21.9% of people had nausea. Almost 20% of people, 19.9% of people had diarrhea, and 13.2% of people had vomiting. And when looking around online, the overall cost for Mounjaro seems to be about the $1,000 per month mark. When we look at the results for the SURMOUNT-2 trial for Mounjaro, and then we look at the results for Ozempic, it's easy to think that Mounjaro is just much more effective at weight loss, which, they had 15.7% decrease in weight in the Mounjaro study and only about a 7.5% decrease in weight in the Ozempic study. But the comparison's not perfect here. And we've seen in the Wegovy study, where they didn't have type 2 diabetes, but it was a much higher dose, that they had about that 15% drop in weight. So the question is the Ozempic dose smaller, so it's producing less weight loss, but it's also producing less side effects compared to Mounjaro? The other thing that's interesting is if the GIP addition to Mounjaro is actually making a difference, or if this is just a more potent GLP-1, which is causing more weight loss. Ideally, we would see a higher dose of Ozempic go up against Mounjaro to see if it could have the same effect. As we've already talked about, Wegovy is just a higher dose of Ozempic. So if you compared Wegovy to Mounjaro and you had the same population that had obesity and type 2 diabetes, or the population just had obesity, then you could get a better idea of what's going on. Now, these studies haven't happened yet, but they're in the works. And eventually, somebody is going to do a randomized controlled trial where they compare Ozempic, Wegovy, and Mounjaro all to each other and see what the results are. And that'll give us a better idea of the side effect profile, the results, and which one works better. And it may be that they all work about the same since they're all working on that GLP-1 receptor agonist. So it can get confusing. And I know some people are probably considering taking these medications, and that's totally reasonable. There's been a lot of people that are losing weight and they seem to have side effects at the beginning, but the side effects generally start to wear off. We don't have the long-term safety data on this yet, but just because there was a thyroid cancer concern in rodents doesn't mean that's going to transfer over to humans. They also say that if you have a history of a certain type of thyroid cancer, or you have a rare disorder that predisposes you to thyroid cancer, that you should stay away from these medications. And I think that's just being safe and reasonable. It may be that your insurance only covers one of these medications. And if that's the case, and you need to lose weight, I think that's reasonable to take one of these medications. And it doesn't need to be permanent. It just needs to get your body weight down, allow you to build in lifestyle habits that are better and healthier, so that way you can come off the medication and maintain that weight loss. In the studies for Ozempic, it seems like people gain back about 75% of their weight if they do not make lifestyle changes. So the lifestyle changes are going to be super important for anybody on these medications because eventually you're going to want to come off of the medication. Also, Mounjaro entering the arena with Ozempic and Wegovy means that there's more competition, and hopefully what this will do will bring down the price a little bit so it's not as expensive for everybody. There's already compounding pharmacies that are making semaglutide at a cheaper price. So I think it's only a matter of time before these medications get down to a more reasonable price. Now, let's look past the medications, because in these studies, it was noted for every single one of them that the placebo groups lost weight. Now, these are populations that are obese that typically gain weight slowly over time. So you wouldn't expect them to get a placebo and to lose weight. If anything, you'd expect their weight to stay the same or even maybe go up a touch, because that's typically how obesity develops slowly over time. In this case, though, they lost about 3% of their weight in each of the studies. And that's not a small amount. I mean, 3% of 200 pounds is about 6 pounds. And so I looked at what they were doing to lose this weight. And what I found is that they counseled them on nutrition and physical activity. And that's pretty minimal, but the placebo effect is real. These people in the placebo groups were likely taking injectable pens, like the medications come in, and they were injecting them, but it was just water. But that idea that they were going to lose weight and they were kind of keeping an eye on losing weight, as well as getting some counseling on nutrition changes and lifestyle changes and physical activity, led to them losing weight. What we can take away from this is that just by being cognizant of what we're doing, we can have weight loss. So I would recommend a simple way to just start being more cognizant of what you're eating and what you're doing would be to get a journal and just write down what you eat every day. And you don't have to be too strict about what you're actually eating, but you just have to write down whatever you are eating. And by just being aware of what you are eating, you will tend to clean up your diet a little bit. The same thing goes for physical activity. If you write down what you're doing every day, then you are going to be aware of if you are inactive or if you're getting exercise. And it may just start with a simple walk outside, but if you write down what you're doing every day, you can see that yesterday you did a 2-mile walk. And so you may think, well, today I have to do something as well. And you're likely to be more physically active. And those are the positive lifestyle changes that can have an impact that goes much longer than just taking a medication. And the reason people take these medications, lose a bunch of weight, get off the medications and gain the weight back is because they haven't made the lifestyle changes. So if you make the lifestyle changes, you can lose weight without taking these medications and you can avoid all these side effects. And even if you do take these medications, you can take them for a short period of time, have the lifestyle changes, so that way when you come off of the medication, you don't gain the weight back. So those are my takeaways from what we've talked about today. Ozempic, Wegovy, and Mounjaro likely are all similarly effective, but they're just different potencies. And there will be studies that come out, compare the three, and see how effective they are compared to each other. The other thing that I want you to take away is that by bringing awareness to what you are eating and how physically active you are, you'll be more mindful of it and you'll live a healthier life. And that's all I have for the podcast today. If you enjoyed this and you're on YouTube, please click subscribe below. If you're on Apple Podcasts or Spotify, please follow. This is The Prescription Press. I'm your host, Nolan Fisher. I'll see you next time.